everybody, we're live. Sorry, this is not a great. Anyway, how's it going? Nikki Burnett here, Taste Like Nutrition. This is Taste Like Nutrition Radio, streaming live on KUHSdenver.com, where we are here to bring you as much truth and have a little bit of fun as we possibly can. We are here to hopefully help you see outside the conventional. For those of you who only see the conventional, right? We want you to see or learn about people who are here to serve, who are here to give, and who love what they do. And all good, yeah. and give guidance. And so, can you get in that camera over there?
This one.
There you go.
There we
Cool. Anyway, so we bring on people who are here really who are amazing at what they do and are here to make the world a much better place. And we need a little bit of that. So anyway, we have today Brad Schoenthaler. Yes?
Close, yeah.
Say it.
It kind of depends on where you're coming from, what part of the country. Phonetically, we say Schoenthaler.
Okay.
It's German background, so if you actually say it in German, it's Schoenthaler.
Ah.
But there's no D
Okay.
in the
Yeah,
spelling.
interesting.
So when you say Schoenthaler, it confuses a lot of people. So we just go with the phonetic Schoenthaler.
Schoenthaler. Got it. All right.
Yeah.
It's a good one.
Yeah, for sure.
It's a good one. Anyway, Brad and I met through our friend Paul, who was on the show with us with the process last week. I don't know if you saw that, but Paul was on with me last week. Yeah. So we met and connected and had a lot of fun, had some fun conversation, and really wanted to bring him on because he approaches physical therapy in a little bit of a unique manner. What I love is, what all of us in these, you call it the functional world, right? You're in the functional world. It's all about the way that we function biochemically, biomechanically, everything works together. And in that, he has a certain specialty or a way of working with people that is just that. It's very connected. The body's connected. We're connected. We're all connected. And it's beautiful. And so I did go to Dr. Joy Lee's website. What's her first name? Linda. Cool stuff.
Yeah.
Really cool stuff. Anyway, so as always, before we get started, we start the show with gratitude. Gratitude can change the world. And that's what we want to do, is make it a happy place so we can all do the things that we're put here to do. We're here to grow and to build each other up and to hopefully have as much fun as we can. So, what are you grateful for?
I would say I'm grateful for my community, which would just include my family, my immediate family, my extended family, my work family. So thankful for all my staff and my coworkers, and our friends, Paul and yourself, and our process crew. So I would say kind of like my community of friends, which is a very important thing in my life. So.
Yeah. It's so important to surround yourself with the people who are there to build you up and to help you grow, and then you help to build others up. And I know it's repetitive, I say it a lot, but I know I'm super intentional about the people who I surround myself with, and I think it's important to be intentional. There are those who have the ability to drag us down, and sometimes we either need to have a conversation or we have to not allow it to happen anymore. Maybe leave the relationship. Sometimes culling relationships is a little bit better for everybody. So just keep that in mind. Don't allow yourself to be dragged down. Life is way too short. So help build others and be around people who are going to build you. I'm going to be a little bit shallow today about what I'm grateful for. I'm super grateful that with the storms that we had last night, and we did have some hail, that none of my gardens were damaged.
It's actually a big one. Yeah.
It is.
And then your summer very quickly.
Yeah, exactly. Yeah. We were sitting outside. My husband was doing a bunch of work, and we start to hear it. He's like, okay, what do you want me to bring in? I was like, well, I have a few potted plants. That would be great, thank you. But everything, we can't cover all of the gardens at this point. Everything's pretty big. So no damage as far as I know. No damage to our awning, nothing. So, and I think it wasn't as big here as it was maybe up in the foothills and the mountains. I'm not sure, I haven't heard, but I did see a post where, I don't know, and the foothills are pretty big.
Yeah, the Red Rocks videos were.
Oh, I haven't seen that.
Yeah.
Really?
Yeah, there were some injuries and
at
the concert last night.
What was the concert? Do you know?
I don't know.
Not that it matters. I don't either.
Yeah.
But that's scary. Yeah. What do you do with that?
There's not a lot of coverage out there.
Holy smokes. Red Rocks from our house is 15 minutes. So interesting how it can change as you come down the hill a little bit. So anyway, now I want to dig in a little bit to who you are, where you come from, what brought you to this place. I will give a shout out to the Jayhawks because you're a Jayhawk.
I am a Jayhawk.
Yeah, my husband's a Jayhawk, so we're a big Jayhawks fan.
I did not know that.
Yeah, third generation. Yep. So we do love our Jayhawks, and so that is super cool, and it's a great school, especially the medical school and the PT school. Great school.
Yeah.
So awesome. So let's talk about that. Talk about where you came from, what motivates you, what excites you, all of the good things.
I'm originally from a small town in western Kansas called Ellis. I went to undergrad at the University of Kansas, like you mentioned, and transitioned right into graduate school at the Medical Center in Kansas City.
Okay.
And then that was in 2005, so I've been practicing for 18 years now, which is quite possibly the craziest thing
it's amazing.
to say out loud.
Yeah.
I remember when I was excited to tell people that I was 2 years or 3 years out of school, so I had a little more credibility with my patients, and here I am 18 years later. So I kind of made some roundabout work travels to Dallas and to Seattle and to Vail, and then I finally ended up in Greeley, and then finally in Denver in 2008. So I've been in Denver since 2008. And then my business partner and I started a self-pay clinic in 2015 called Sports Rehab Consulting. We're located in kind of Sunnyside Highlands in Denver. So we've been
a great
there.
little spot.
Yeah, we've been there since 2015. We've got a great staff of a handful of therapists that have just kind of been doing our thing, finding our niche, and we've just kind of been plugging along and slowly kind of finding our way in what I would call like an ever-evolving medical world. You kind of have to find your way into where do you fit, and like you said, within our areas, you kind of talk about connection, and we really look to specialize in our community of like physiotherapists in the physical therapy world, and so when you're in the self-pay world, you kind of have to find where you fit in, and so that's kind of been our journey the last 8 years, and we feel like we've got a pretty good grasp and hold on it, and we've been able to slowly grow and bring on really exceptional team members. So from a motivation standpoint, we're here to kind of talk about ConnectTherapy, which is more of a kind of a specialty within the specialty of physical therapy, and I would say that kind of renewed my excitement about the physical therapy field.
So this is newer for you, the ConnectTherapy?
It's newer for me.
Okay.
I think I took my first class maybe in 2017.
Okay. I feel like you probably told me that, but I had forgotten that it's fairly new for you.
Yeah, so I had been practicing for quite some time, and one of the reasons we had started the self-pay clinic was, just being essentially not satisfied with the results you were seeing, having to go through the insurance world and the demands that puts on your staff and your team. You just don't have kind of the time that you think is necessary to really help people. So I'd say the work was becoming less and less satisfying, and you felt like you were having to run people through faster just to kind of keep paying the bills. And so
just real quick, and I think that it's sort of important to hit on, because I think what we're seeing, which is can be difficult for some to appreciate, because it tends to increase cost a little bit, but it also increases care when we get away from the insurance and the demands of insurance. You know, I mean, we've all experienced it. I think. I mean, I know I have, and I hear it in practice all the time. But in our conventional world, where doctors, PTs have a very set amount of time and effort that they have the ability to put into the care of their patients and clients, it's problematic, especially if you're dealing with chronic conditions and issues and all of so many of the things that we deal with in our society today. We see that a lot of practitioners from all modalities are moving to cash pay and getting away from insurance.
Definitely. It's, I would say, much more common than when we did it in 2015. It was definitely a big jump, but I was also at the time in my career where it was, you know, partial burnout from not seeing the results you want to see, and which is one of the reasons that also kind of led me into the ConnectTherapy. Was like, there's got to be some other answers out there. Like, what else am I missing that I haven't necessarily gotten answers to, maybe through more conventional continuing education classes or conventional teachings, things like we're taught in school. So the journey kind of started there. It was like, I need more time to kind of process getting some of these people better. You'd have certain people that they get better right away, and then you'd have the people who were harder to get better, and then all of a sudden that's your whole caseload, because the people that get better leave, and then you end up with a full caseload of, and it can be frustrating when you have a full caseload of people that aren't getting better, and you feel like you kind of need more time to problem solve, and there's just not that route. So going back to the original question, was like, what motivates me? It's nice to be motivated by my profession again, which I would say, you know, 7 to 8 years ago was teetering more on the burnout phase than, you know, I was like, I got to do something to not keep down this path, because this path isn't working for me. So I can happily say I'm like very motivated by problem solving and kind of this new approach that I've learned. And it's like medicine in general is always like a constant learning. Like, anybody that says like it's all figured out and we're not still adapting is, you know, they're off base. Nobody knows it all, and it's nice to be part of that evolution of like things that we're figuring out as we go. So you never really feel that it's stagnated, which is nice. I wouldn't want to be a person that feels the redundancy of going to work being bored, or that there was nothing left to continue to go. And so that's like a big career motivating thing.
It's got to be, I think it's got to be really, and I say this again because I've experienced it and I've seen it, but there are those who have their specialties. They get stuck in their specialties. They don't go outside of what they already know. They don't go outside of what they've already learned. They don't continue to keep up with evidence-based medicine. I was going to say the science, but I've stopped saying science. So I try to use the term evidence-based. That's not always really appropriate either, because you know it's science is frustrating.
It's a deep rabbit hole.
Is frustrating today. But with that being said, that's people like you are who I want to bring on the show, because we want to dig, we want to learn more, we want to understand at a deeper level, and take a step back and say, holy smokes, I was wrong. Because now we have new data and we have new evidence, and this is how we can now veer to make what we're doing even better. And it's a great thing. It's a beautiful thing. It sucks when you're wrong, but we're all wrong a lot of the time, which is kind of part of life.
Yeah.
So
It's more you just don't know any better. Would
right.
be the
Right,
best
right,
way
right.
I describe it. It's
I
like
think
you
that's
don't
great.
know what
Yeah.
you don't know
Yep, yep.
until you know it. And you're like, how did I not know that? I look at it more from that perspective.
Thank you.
Like
that's a good
how,
perspective.
at least in my practice,
Yeah.
I look and I'm like, I can't believe I missed that. I can't believe I didn't see that right in front of my eyes.
Yeah.
And but it took a step back and kind of having to start over, which is probably the most difficult thing to do in your career when you feel like you've been climbing and you've made progress. To kind of step back and be like, well, maybe I don't. It means you have to go start back to feeling like you know less and you're maybe less experienced than what you really are. So I look at it more of that context. And I just don't, this is one of my like medical soapboxes, I feel like there's just not enough people saying that they aren't sure or don't know, because with, you know, the ICD-10 codes and everything else, you have to have a diagnosis. We have to tell you what's wrong with you. We have to, versus, I don't really know. It's kind of diffuse. There's a lot of things out there. We got to put a lot of stuff together. We're going to work on it and figure it out. And it might take us a month, might take us 6 months, might take us a year. But they want that answer in 15 minutes. What's wrong? And in the insurance world, in the medical world, it's not normal or from a billing perspective okay to say, I don't know. I don't know why you're having that problem, but let's look into it. We'll slap a diagnosis on you first, and then maybe we'll look at it. But there's more of, I feel more benefit to be gained from taking a step back and saying, like, we have to solve this. How do we go about solving it? And then you get to your answer at the end, versus trying to have the answer in 15 minutes.
Yeah, you know, I have clients who come to me, and obviously I can't diagnose. Not a clinician, I'm not a doctor, but I can certainly look at labs and, you know, look at symptoms and understand what's going on. But a lot of times I tell people, even if there were that it's not always about finding a diagnosis. It's just finding the root cause. You know, a diagnosis is a diagnosis, right? Is a cluster of symptoms. And we're like, okay, so now we're going to put a name to it. But what's causing it? And so, you know, whether it's biomechanical or biochemical, what is the underlying cause of, and I'd say biomechanically, if you have pain here, it could be down here, right? It can be, and that's about as far as I can go with biomechanics. But, and I say this a lot too, and I said it in our promo video, is that, you know, our toes connected to our ears. And so everything's connected. Getting back to kind of why you are practicing the way that you practice is, it is knowing that everything's connected and knowing that there is a foundation, and what is it that's disrupting that foundation. So digging for the root cause, learning what it is. It may not have a diagnosis, but if you address it, the likelihood of being successful in, for you, your treatments, and for me, my protocols, is a lot higher. Yeah. So talk about being connected. Let's talk about ConnectTherapy.
So I started kind of down my path of ConnectTherapy. I would say, I think the first class I took was in 2017, and the teacher who kind of holds the continuing education courses is based out of Vancouver, British Columbia. Her name's Linda Joy Lee. I had heard her on a podcast, strangely enough, probably back in 2014. Was on a run, and she was talking about treating the thorax, which in the physical therapy world is kind of like this elusive, we don't have a lot of treatment strategies, and so I was eager to kind of see what she had to say, listened to it, was interested, never really followed up on it, and then started to do think about that application a little bit more when I started doing more self-pay work at Sports Rehab Consulting, because we had more time, so you could sit and process a little bit more. So then I started to research her stuff a little bit more and started taking classes. And the first class I took with her, because I'd been to a number of continuing education classes prior to this, you know, in my 12 or 14 years prior to taking this, you get some tidbits here and there that you can use. Some of them are useful, some of them don't work as well as you hope, but you're kind of adding tools to your tool chest of like how you can treat, but you still come up empty on like so many times, and I have all these patients that trying to figure out answers to why they're experiencing what they experience. And an hour into the first class, I was like, she speaks my language. Like,
amazing,
this is what I've been looking for. This is a more introspective way to look at like what we're doing. So to talk about ConnectTherapy as a whole, I would say, you know, this is a methodology that she kind of created through her background in doing her PhD work in biomechanics of the thorax and the rib cage. But essentially we would consider it a, I don't love the term holistic, I would say comprehensive.
Okay.
It's like a very comprehensive approach, multi-system approach to assessing and treating dysfunction. And that dysfunction can be painful dysfunction, it can be non-painful dysfunction, it could just be, you know, stiffness. Doesn't have to be my knee hurts, it could be like my back doesn't move like it should move, or I've got abdominal cramping that I can't get to stop. And so her methodology is this, when I say multi-system, we really look at every system. You're looking at the neuromuscular system, you're looking at the musculoskeletal system, you're looking at the digestive system, the visceral system. Like, it is like you really have to take a step back and look at the individual as a whole, and what all is contributing to what is going on. And as you start to kind of break things down, you really see the interaction of how crazy connected your body is from a multi-system approach. Part of that, within that multi-system recognition, there's things that, as a physical therapist, we're very adept at fixing. So, like, we're really great with the neuromuscular system and the musculoskeletal system, and like treating those dysfunctions. And you know, one of the things you learn in school is like, when do you refer out? And so there's times where we'll see somebody and they might have a physical presentation of symptoms, but we might think that's coming from somewhere else. That might be a visceral referral pattern, and how do we get, from an assessment standpoint, to locate that? And it could be, you know, there can be any system involved. This could be a digestive system issue where it's like, I think what you have coming on is more visceral and digestive, I'm going to refer you out. But you really start to see the interplay of multi-system factors in movement dysfunction and what people experience. And we, in the ConnectTherapy world, it is, you really see, you know, everybody always says like, oh, it's really connected. And it's like, once I've started doing this style of treatment, the number of times that patients say that, like, I never would have thought that was connected to that. So it's always the ongoing joke that the hip bone's connected to the knee bone. But it just goes, the rabbit hole is so deep, once you really start to see how one thing can affect another, and how one system can affect another. And we've always known that to a certain extent. You know, there's certain examples that you learn even in school where it's like phantom limb pain. It's like, you know,
Yeah.
we have these people who don't have like a limb anymore or a foot, but their foot still hurts. And it's like, well, there's an explanation behind that because that's a different system. Like we don't actually have. So if you kind of take that and put that at the top here, where it's like, we know that's available and we know, we think we understand it. And then you can start to really, like, her system that she's developed, it's miraculous that she's kind of was able to figure a lot of this stuff out and put it into a form that you can teach and take and pass along to, you know, because there's certain people who are just gifted. They're just, you know,
For
it's
sure.
like medicine.
Yeah.
But can they take it and explain it and teach it to somebody else? Her ability to like really dig and get deeper and deeper and deeper to really understand how the body works is, it's crazy. It's a game changer.
Amazing.
It is.
It is amazing when you have people who approach the medical scene to make it all, you know, sort of all encompassing, have that ability, that gift. I love that you call it a miracle because I agree, of changing the way that we see what we've all seen in the past, right? It's phenomenal. It's beautiful, and I love people like that too. You make me want to take her class, and it'll be way over my head, but
it's crazy. You definitely leave with a bunch of squirrels running around in your head trying to reorganize.
Yeah, well,
essentially how you perceive and how you look at things.
Yeah, you have to unlearn a lot of things. Yeah,
that's the again, going back to the point of you don't know what you don't know.
Yeah.
It's hard to think that you're a specialist and then go back and be like, I actually probably don't know as much as I think I know. And that's a difficult thing to do.
Yeah.
And I think some progress in medicine hits that barrier because it's not an easy thing to do.
Yeah.
It's stressful. It's hard. It's frustrating. When I was first learning it, you go through like a really hard relearning curve. It like really is like starting over, and it's not an easy thing to do. But when you come out on the other side, the benefit is great.
Well, it's you know, the hard things are all the things that make us better.
Exactly. Yeah. But it's what hard things do you want to, or are you open to encounter, right? It's like, my job should be the thing I shouldn't have to like worry and stress and refigure out after I've been doing it for 15 years. Like I should be able to put all my focus onto like my garden and like how's the yard and I got to re-landscape, you know, like you kind of create difficulties, or, you know, some people they're like, I'm going to go do an ultramarathon. I gotta like stress my system, you know, not everybody chooses to do it in an area that, sorry, like, well, I already know that. I don't need to like relearn accounting. You know, I'm not gonna look at accounting a different way. I'm gonna push myself in another way. Like we have a unique opportunity to do it in our profession, which like I said earlier, the beauty of the medical profession is it's ever evolving. Yeah. Like we're far from having anything fully figured out.
Oh yeah.
So there's always room. There's always room for progress.
Yeah, thankfully.
Yeah, exactly.
So I have a couple of things. So let's see. I think we already covered that. This would be a good question. And you know, when it comes to the model, the ConnectTherapy model, are there certain people who fit this model that you treat, or are there people who don't fit in this type of model? Does that make sense?
Yeah, that's a good question. Everybody fits.
Okay.
You're essentially, through the model, you're trying to find out why the patient is experiencing what they're experiencing, whatever their complaint is. And again, you know, in the physical therapy world, we deal a lot with pain, and so pain is like a very common thing that we're trying to solve. There's other people who come in and they're like, I'm just not happy with my performance, or I feel like I'm not as strong as I should be, or like my hamstring doesn't work like the other hamstring works. And so you know, you're trying to kind of solve these problems like, why is that? Is this a structural problem? Is this a biomechanical problem? Is this like a movement thing? So the model applies literally to everybody. It's an assessment to find out why the patient is experiencing what they're experiencing. Some of those people are just they're more straightforward.
Okay. Yep.
So less complicated history. You might get better very quickly, even on your own. Like if you sprain your ankle and you kind of get back and go, you may not notice anything different. Like you kind of, I don't call it healed yourself, but like you kind of resolved back to normal. I would say the people that it stands out more for and where I've seen the biggest difference in my practice is it helps, the ConnectTherapy model is especially great for people who aren't responding to what they've been getting traditionally. So, for example, like my practice and a bunch of my colleagues, like we would be considered more hip specialists in Denver. Like we've been seeing hip surgery patients and non-op patients for hip pain for years. And so I would say I've taken tons of hip courses and pelvis courses and low back courses, all to kind of develop as many tools as possible and to treat in what I would call like a traditional sense, like a non-connect therapy, like kind of what you're taught in school, typical manual therapy courses. And so you would have, as I mentioned before, I would have, 16 people a day on my schedule, 14 of them are hips, 7 of them get better, 7 of them don't. And then that slowly increases to where I have 9 people on it that don't get better, and then 12 people that aren't getting better, but they're not leaving because they don't have anywhere else to go. They've already seen 1 or 2 people before me, they've seen their hip doctor, they've seen the surgeon, they've had surgery, and they're still having hip pain. And what I did with these 3 people that made them happy and walk out the door, a great outcome, don't work for these ones. And you wonder why. Like, what am I missing? How does this work in this instance and this doesn't work in this instance? And then you find out, once you kind of get into the ConnectTherapy world, like what other factors, what other systems can be affecting this? Where can some of these other things be coming from? So we use the term diagnostic. We don't give people like necessarily like a diagnosis, like you are a low back pain. We would say like your movement dysfunction is driven from this. Like your foot and ankle are not moving right. That stress is being transferred up the chain. Your hip is not able to move like it needs to move because your foot and ankle, and how I go about treating that is very nuanced and very detailed based on like what we see. And so, the short answer is it's very beneficial for people who aren't responding well to like what I would consider like traditional, and it really allows you to go search. You have the tools to go search for like where else could this be coming from, what other things can be causing this. And again, that's where it starts to be like I can go look up and down the chain biomechanically, musculoskeletal. It may not be any of those things. We might have to be talking about all sorts of other things. This could be referral patterns, there could be, and the assessment technique through ConnectTherapy kind of allows you to get there. It's like a roadmap of if you follow this and you follow this and you see what the body does when you do these things, you get your answer. Which is like a very empowering thing to have as a tool set, even if you don't figure it out right away. If you're able to follow the steps, you'll eventually get there. It might take a long time. There's some people who've taken a long time. A lot of my patients will tell you they've been very understanding and very patient in my problem solving, and have been coming for a long time. But we make gains along the way, and you eventually start to get to your answer.
I mean, when you're dealing with super complicated cases, I mean, I think that it just happens that way sometimes. I mean, the body's complicated in and of itself, and then when you're dealing with complicated issues on top of a complicated body, it can make it hard. And if they've been dealing with the issues for a long time, and then probably other issues come along with that, right? And so it just gets hard.
It gets very complex. There's a lot of layering that goes into it. From a treatment perspective, you know, one of the things that I don't necessarily think I would have appreciated, I know I didn't appreciate prior to starting this journey, would be it matters in what order you treat things, and like how you need certain things to be working well for other treatments to work well. So if I'm going to work on your shoulder, I need to make sure that your hip and your ankle are good first. Otherwise, I'm only going to get so far with the shoulder, and that's like a very big picture thing to look at and think about, and it can be overwhelming, and it can be so abstract at the beginning, but as you start to put it together, it kind of makes sense. But that's also like, you see why somebody with like 3 injuries now has pain here, because they've stacked on top of each other. How I've compensated for a car accident that left me with, you know, less neck mobility has then led to me overusing my shoulder when I swim, and then overusing my shoulder when I swim has led to my opposite hip being tight. And so if I just go to treat your hip and I haven't unwound the neck and the shoulder, you're not really going to gain anything. And so the ConnectTherapy model allows you to find that. It's like, oh, here's probably why your hip's tight. Like, I know your hip's tight. I can feel that. Like, we can do some manual therapy and release it. But when it comes right back, that tells us that there's something else driving that movement. And so it's just it's a nice model to go find your answers sooner. If you follow it, the roadmap will say, like, you know, you kind of combine your physical test with the history. We got to get a very detailed history. We need to know about, like, what are the significant impacts in your life? Like, what things are going on? What are your job requirements? What traumas have you experienced? What surgeries have you experienced? Like, what left you, like, unable to move in your history? Because then we can start look through it, and I can start to get a pretty good idea of, like, well, this is probably a major turning point. We should maybe look at your neck from your car accident 10 years ago and make sure that we're not missing something there. So you can get a lot just in the history. But again, to the point of, once I know that your hip pain is the most recent thing, but your neck was 10 years ago, I can safely think that, like, if I'm treating in order, I'm probably not going to get a lot of success going right to the hip. I should maybe start at the neck and then work my way back through. Those are kind of like very general, like, basic, follow the dots way of looking at it, and appreciating that it matters in what order you do things.
Totally agree. And if I were to think about it, only because this is super recent in my own practice, very similar way of practicing, is I have a client who's like, my hormones are totally out of whack. I want to get my hormones tested. All right, we can do that, but let's understand why your hormones are out of whack, right? Let's look at your GI. Let's look at toxicities. Let's look at all these other things that are going to be what potentially are the instigators of your hormones not making you happy in all of these different ways. And so it's that, I mean, that's why I love it when you talk about it this way, because we're on the same wavelength. It's like, let's look at, you've got your problem here, but let's understand why, and go in a way that may not make sense to you, but I got it.
Yes. That's the definition of the ConnectTherapy, is like the why. Like, we're going to go and we're going to dig and we're going to find out why. And to your point, my patients that on their first visit kind of think we're crazy with, like, some of the stuff we're doing. They're like, you know, I'm here
That's
for
not
my,
my
I'm here,
hip,
I'm
it's
here
my
for my,
shoulder.
yeah, I'm here for my knee pain. Why are you looking at my neck? My neck's
Yeah.
fine.
Yeah,
My
yeah.
neck's stiff, but it doesn't, that's fine. I'm fine with neck stiffness. Fix my knee.
Right.
Like, well, I can't really fix one without the
Yeah.
other.
Yeah.
I know that you don't care about it as much. I care about
Yeah.
it, and, you know, some people have like blind trust, and they're like, yeah, whatever you gotta do. And there's other people that look at me like,
explain, please.
yeah, what? Why are we doing this? Like,
but you're good. You want to have those who are like interested and want to
Yeah.
learn and understand and dig in. I love that.
in your world too, the more they understand, the faster they get better.
Yeah.
Because you're now more proactive. You're now more empowered to, you know, take things into your own hands. When you can show people like, this is how you're not moving well, and like once this happens, then this will happen, and this will happen. Then when things go awry, they're more pointed with what they're doing to fix it. So their hip starts to hurt, and they're like, oh, maybe if I like stretch my neck out and do these neck exercises, my hip will feel better, instead of like hopping on the foam roller for 20 minutes trying to roll out their hip, which is just going to come back 10 minutes later. So the education piece is important. We don't have to teach as much as you and I know about it, but you teach them the highlights to empower them to the point, you know, where it's like, there's a lot of reasons why, and you need to understand some of them if you're going to, you know, like when you and I have talked about like empowering people for a lifetime. Like we're not putting you on a 3-month diet. It's like we're changing how you do this. I'm changing how you move. I'm teaching you how you need to do this for the rest of your life. And that takes time.
It does. So I'm going to take this opportunity, since you said that, because it's perfect, and because Henry put up the graphic in the back, I'm like, okay, this time. Just to talk a little bit about a lifetime of health, right? And so Soulful Conception, as you know, if you have been watching, is a new program that has been created in order to create a healthy pregnancy, a healthy body, healthy pregnancy, a healthy baby, but we have the ability to impact generations. And so my goal is to bring in the best of the best when it comes to my guest experts who come into this program with me to help me with clients, and then give the best information that I possibly can to clients. And also, kind of like with this show, open them up to what is available to them. I think a lot of times, whether we are preparing or struggling with fertility or going through treatments, whatever it is, so often all we know is what's been put in front of us to that point in time. And I want people to see that there's so much out there, so many amazing people who are out there. Again, like I always say, is to serve and to help and to guide you through your journey, if it's a journey to health, if it's a journey to growing your family, whatever it is. It's a journey to creating health for a lifetime and health for many lifetimes to come. So, good stuff. Had to throw it in there. Henry's like, I'm like, good timing, Henry, thank you. Takes care of me. So anyway, you can always just, go to tastelifenutrition.com and check it out. Reach out. I am here to serve and answer any questions that you have. So now I'm in my own sponsor right now.
Go for it.
It works. I like it. So anyway, I want to talk about a couple of things that I have questions about that came from your website. I put a note in here, everything and everyone is connected. I was like, love this, that's good stuff. So there are a couple of things, the thoracic ring approach and the circles of influence. Are these part of your training, or are these other trainings that she does?
It's part of the ConnectTherapy model.
I figured it was. And so curious what that is and what that's about. Or is that too detailed, too deep?
No.
Okay.
Not at all. The circles of influence, we'll start there because that's the overarching principle of ConnectTherapy, is like you're really, she'll describe it in the graphic, looks, essentially like a Venn diagram of, 3 circles, and where they overlap in the middle is the individual. And the circles of influence are all the contributing factors that we talked about from the systems model. So this is like your social, like what's going on in your life, what's your family dynamic, what's your work dynamic, what's your stress, what's this. And then over here you kind of have, you know, different systems, which could be, again, we talked about like the hormone system or the vascular system or the neuromuscular system, the nervous system alone, you know, like what does your body do like after a concussion? Like
leaky gut
like,
immediately.
Yeah, that is like,
yeah.
you know, when we talk about things that we don't know that we're making progress in and we're learning, like concussions and how the brain, the plasticity of the nervous system, and so again, you're kind of you're having to account for all of these things. Like when you look at the person, it's like you kind of come in with your presentation and you have these complaints of like just what you don't like about whether it's your movement or the pain that you're having or you know, it could be anything, like you said, leaky gut. And we're trying to assess like what, you know, how are all of these things contributing to you in the middle and how you can't really mess with this without having an effect here, right? Like as soon as I start you ever listen to the Huberman Lab? He's great. Definitely listen to him. He's always, when we're talking about the advancement of medicine, he's kind of out there like, hey, here's what's new, here's what we're learning. And he uses the term something like you can't pull on the string without getting an effect down the chain. Something along the lines is there's nothing more true than like in the blood work world, like as soon as you start moving one thing, something else is like you don't get anything in isolation. And so you really kind of appreciate how your body pulls and takes from certain areas, how like a change in hormone is going to increase this, and how this might have a physical manifestation. You might have neck and shoulder pain that isn't biomechanical at all. It's part nervous system because your nervous system's ramped up, but your nervous system's ramped up because your hormones are, and that could be driven from stress could be driven from like what you're eating, could be, you know, an allergy to something you don't know you're allergic to, and it's like, I can assess you and be like, this is not mechanical. I don't know necessarily what it is, but I'm going to refer you to somebody who might, you know, we're not done. We got to do some more searching. So the circles of influence, you know, it's, you know, part of the class is just the hours that you spend appreciating how different systems can have different presentations. And it's more of like a case study look at things versus like this is always this. There's none of that teaching in the ConnectTherapy. It's like this could cause all of these things, and you have to be able to take all of those things and then push it back to find what we think part of the root cause might be coming from. So that's what the circles of influence means. It's just, you know, how each of those systems can affect other systems. And the thoracic ring is essentially one of those systems. We look at the thoracic ring as kind of the basis model that she kind of developed, and not to put this into her words, she might describe this very differently. The thoracic ring course was the first one I took that then led me to take the ConnectTherapy. But I would say the thoracic ring is kind of the essential part of the assessment and treatment that helps you find what we're looking for. So if I'm looking for dysfunction somewhere else in the system, if I know how to assess and treat the thorax, I can get a lot of information, which in your world is very interesting because we look at a lot of the nervous system input, especially for the visceral system, comes from the thorax. So you can have things like decreased blood flow and maybe decreased nervous system input. So you might find that, you know, there's certain, you know, your liver is not functioning at capacity or you're not, but we also found out that you had a car accident 6 months ago and you fractured 4 ribs, and that compression is now blocking optimal blood flow and nervous system input to and from, and so you actually have part of a neuromechanical component that's like giving you this visceral presentation.
Yep.
So when I say the rabbit hole goes very deep, it goes deep.
Yeah.
But when you know how to treat and assess the thorax, so I would say that's like one of the central components to the ConnectTherapy model. Like you can't do the ConnectTherapy model if you don't have that foundation. So that's what we use to kind of guide a lot of like what we're looking for in the search for things that could be causing what you're experiencing.
I love that too, because one of the things that we talk about a lot here in the show is always building your team. When you have your whatever it is that you're dealing with, knowing that you have your specialists who are, you can call them the comprehensive or your holistic
Generalist.
Specialist. Well, no, I mean I'm talking about like, I'm a functional nutritionist, so I look at all of the things, but I know I can't do anything with biomechanics, right? And so I can do what I can do, but I want to send you over to somebody who can do what you can do. And then if there's somebody, if you need also help with somebody who looks at things in a holistic manner or a comprehensive manner, but can help you with specifically your mindset, your mental and emotional health, right? It's all of these things that come together where you're building your team, and your team, they are aligned, but different, right? Aligned in the way we approach your health and willing to co-manage, but have your area of expertise along the spectrum. That makes sense. So,
which I feel is like why we kind of connected in the first place was common approach to finding the why. Yeah, exactly. Yeah.
Cool. Let's see. What other fun things do I want to know? I had actually a couple of questions that are kind of general questions. I want to talk about cupping.
I'm not the person to ask
You're
about
not?
cupping. No.
Okay, because they do cupping, and
yes,
you do dry needling.
Yep, we do dry needling. I can speak much better about dry needling than about cupping, primarily because I haven't taken the cupping course.
Yeah.
But it's essentially a treatment modality to accomplish something from a soft tissue perspective, or a vascular perspective, where you're, those are kind of the two systems you're affecting. So when you look at modalities, it's like, what system am I trying to improve? Am I trying to improve like the neuromuscular system? Am I trying to improve the musculoskeletal system, which are kind of like physical therapists' two main areas. So most of the modalities on there are kind of like directed at addressing, one of those systems that you feel is blocking what needs to be resolved to restore like normal biomechanics.
So I know cupping's not your thing, and I should know this. I have a close friend of mine who does cupping. I just don't understand it. So is it kind of just to get things moving, the vascular system moving? You just don't know. Okay, sorry.
It's quite all right. All right.
I'm like, I want to know the answer to this, and I don't know the answer. I should.
The dry needling, I can speak more specifically to, and you'll get. Again, this is kind of my take on it and how I describe it to my patients. You might get a different answer from people who hold courses or can speak to it maybe even better than I can, because it's definitely how I dry needle is obviously now a little bit different since I've been taking the ConnectTherapy course, how I do it, how I approach it. But essentially when I'm talking to my patients about dry needling is, more often than not what I see, so like let's say something from the musculoskeletal system is not moving the way I want it to move. I feel like, your hip flexor is too tight and that's not allowing your hip to move biomechanically like it needs to. So we'll talk about the first thing that's happening, essentially the muscle itself. So if you break down the muscle fiber, a muscle fiber needs to have an elastic property, needs to be able to expand, and it needs to be able to contract. That's what, a healthy muscle is going to stretch and it's going to contract. Now there can be all sorts of reasons that muscle spindle that allows that variability can break down and you lose the elastic property of the muscle. So it could be trauma, could be overuse, could be atrophy from like after a surgery. You stop using the muscle, and all of a sudden the muscle no longer wants to like open and contract. Like it's kind of like a dormant muscle. So if I need a muscle to open and to stretch or to activate that's not activating, dry needling, we take a acupuncture needle and you insert it into the muscle with the goal of getting that muscle to release the muscle spindle so that it returns to its natural ability to like open and close again. So we don't do it just to get flexibility. We don't do it just to improve muscle activation. They're one and the same. Like you get them both. So if I feel like, you know, I'm assessing and you're not moving how I want you to move, I'm going to needle what I think might be contributing. You know, that is it's not a structural issue, but that is something that takes more than just like stretching. You know, there's like the in-between of like, how much do you need me and how much can you do on your own? And like just stretching is not going to get that muscle spindle to release. Dry needling is like a more aggressive way to get into the muscle and actually cause a physiological we get a twitch response where like the muscle twitches and that's the muscle you know releasing, and then you have to then retrain that spindle, because if you just leave it dormant, the likelihood that your nervous system wants to take it back to a dormant state. So typically if we're needling, it's like we're going to needle and then we're going to like continue to activate it, or we're going to continue to mobilize it so that it maintains.
Okay, cool. Well, we're at the end of our time. Is there anything, it goes quick, doesn't it?
It does go fast.
Is there anything that we didn't hit on that you want to hit on and people need to know where to find you?
Not really. I just want to thank you for having this chat. It was good to sit down and talk about it a little bit more. Finding us, you can find us again, like did I mention where we're at? We're in the Denver Highlands.
You did.
Yeah, we're in Sunnyside. So we just have a small clinic in Sunnyside. You can find us online at
Colorado, for those who don't know.
Sorry. Denver, Colorado, Sunnyside neighborhood. 39th and Fox Street. You can find us on our website, which is Sports Rehab Consulting.com. That's also our Instagram handle is Sports Rehab Consulting. You can get information on there. It's the easiest way to get a hold of us. There's a question form or a submission if you have any questions. It'll go to our admin account, and so if you want to know anything else, we're there. Awesome.
So I do have a quick question about that, because I know I saw that you do some telehealth, some virtual stuff. I mean, you're mostly hands-on. Are there things that you can do for people who are not close by?
We can. It's much more limited.
Sure.
In what I would consider like a successful outcome.
Yeah.
A lot of what we do would be education and trying to put the history together to give our best guess scenario of what can be, where should we start looking. So, you know, if we're trying to sort through this whole array of things, all right, let's start talking about, you know, is your best bet, you live in Cincinnati, is your best bet to try to go find an acupuncturist? Like, let's start there. We think you have a nervous system issue, or we feel like you have hormone, like, contribution, like, we need to, like, start going down this pathway is where I think you'll probably get the most bang for your buck. Or you need to see, like, a massage therapist, or, you know, do you need to, like, more than anything, it's like we're kind of there to give guidance. If I can't get my hands on you, I'm very limited in the problem solving that we can do. But we're still a resource from a guidance standpoint to try to help get you an answer.
Sure.
Again,
the best you
can. It might take some time, but you're kind of you then get to like your best case scenario.
Cool. Awesome. Thank you.
You're very welcome.
Good stuff.
Thank you.
Yeah, so glad you got here. Or you came. You got here. I don't know even what that means.
It did take a second to find it.
Yeah. Sometimes, words are hard for me sometimes. Anyway, thank you again for joining us. We're here every Thursday, 10 a.m. Mountain Time, here streaming live on KUHSdenver.com then you'll find us as the Taste Life Nutrition Podcast on all of the places where you find your favorite podcasts. Go to the website, tastelifenutrition.com. You can fill out the assessment there. It's a free assessment, and then I'll reach out to you personally. We'll chat a little bit about what's going on, and see if I might be able to help or if we need to send you somewhere else. Again, the goal is to be a resource and do the best that I can to give you whatever I have to give you. So beyond that, all of the social, Taste Life Nutrition, if you have questions about soulful conception, if you know people who are looking to get pregnant, who are thinking about it, who are trying, who are frustrated, or whatever the case may be, have them reach out to me. I'm always happy to chat about it and see if it's something that is beneficial, which I think it is. I mean, in my world, in my mind, it's beneficial for today, and it's beneficial for lifetimes. So, good stuff. Exciting stuff, I think. So, we will see all of you next week. Have a wonderful weekend. Bye.